Wednesday, December 10th. I'm Adam Walsh, and this is The Signal. Today on the show, we will talk about poverty impacts on youth and children in this province, from what we know to how folks are trying to help and what that help looks like and what those impacts are. So the way the show will work, we'll talk about some stats, this report that's been circulating all fall with some interesting findings in it. And then we'll have some solutions and talk about the work that's being done. And this is like the conversation will go urban and also rural, right? Because if we're talking about youth in this province, it's a big old province, and there's a lot of different ways to look at things that need discussing, that need looking at. Jen Crowe is back in the studio, Executive Director Choices for Youth. How you doing?
Doing great. Thanks for having me, Adam.
Thanks for coming in. Kim Dreaddy is here, Pratt Foundation Executive Director. We haven't sat together in the studio before. Welcome.
Thank you.
How you doing?
I'm doing fantastic. How are you?
Good. So before I move on, seeing this is your first time here, just tell us about being with the Jimmy Pratt Foundation and give us a blurb on all the stuff that you folks are doing.
Sure. We're a family organization, a family foundation, rather, based in St. John's, Newfoundland. We nationally recognized. Our vision is that all children in Newfoundland and Labrador will thrive, regardless of their circumstances or where they live. We try to do our work from an evidence-based perspective. We do a lot of collaborating, convening. And our primary focus these days, we try to zero in on what the needs are and what the gaps are in the province for young children. We've always focused on the early years, and right now I think we're, our primary concerns are around, obviously child and youth poverty. We'd like to see the public school system expanded to include 4-year-olds in the way that has been proven across the country to work. And we're particularly interested in early learning and childcare opportunities, a universal, affordable, inclusive childcare system for the province.
Thank you for all that. Nivethine Mahendran is back, Choices for Youth Project Officer. How you doing?
I'm good. How are you?
Good. I as a Mount Pearlian, I grew up in Mount Pearl. Feeling the sister city connection here. Tell us about this report that's sitting on the table, if you could. You want to kind of dig into that?
Absolutely. So this is the third iteration of the Newfoundland Labrador Child Poverty Report Card, and it's done in partnership with a national initiative through Campaign 2000. As my work with Choices for Youth, it's been interesting to see how the data is showing that child poverty is steadily increasing in our province and nationally as well. But it was also crucial for us to get the community context this year. So with the help of the Community Sector Council and Jimmy Pratt Foundation, we held consultations across the province to get a better on-the-ground understanding of what the experience of child poverty is for different communities.
All right, and we'll dig into that. This came out in, was it September?
Yes.
So Jen, this comes out in September, and there's initial news conversations, and then, the weeks kind of march by. What kind of reaction was there to this report when it dropped and in the weeks that follow? What do you hear from folks? Because there's the compiling and then there's the hearing from people.
Absolutely. Yeah. I think that some of the stats that came out of this report were really shocking to folks. I mean, the one that I saw really get picked up, and there was some chatter publicly amongst political parties and candidates who were running, was the stat around for children under the age of 6, there was a 25% increase in the rate of poverty, which was actually the highest recorded across Canada for last year. So that is really shocking. And, I think the part that folks really picked up on was, why is this happening?
Yeah.
What's going on in Newfoundland and Labrador right now that's perpetuating child poverty? And why are we seeing such high rates of child poverty compared to other provinces? We are well above the national average. And what's going on there? Because I think, when you look at it contextually, we talk a lot about housing, for example. We're not in the same rental crisis as you see in Toronto and Vancouver, but we're still in a rental housing crisis, We maybe are not seeing the same rates or same cost of food here in St. John's as we are seeing in some of the northern territories or northern parts of this province, but we're still seeing really high costs of food. So it is proportional, and I think that increase is actually a direct reflection of some of the cost of living increases that we've seen over the last 5 years, as well as the cost of housing increases that we've seen over the last 5 years. So there's a lot to dig into, but I think seeing these statistics and validated so well through national data and also regional conversations that really spoke to people during a time when ultimately we saw a change in government. These were numbers that people really picked up and ran with.
Friday, November 28th, we did a show, Food Insecurity and Impacts on Nutrition in Newfoundland and Labrador. And part of that was we talked about maternal health, and we talked about kids and impacts. And today we're talking about child poverty, family poverty, and ways to make changes, right? So then when you're putting the report together, who wants to tackle this one, what was it like talking to folks and kind of amassing all of this information to put this thing together?
We spoke with over 100 community groups and individuals who work in the area of child poverty in those various sectors where they meet with people who are experiencing poverty in their lives. It was a difficult process. It was difficult to facilitate these focus groups and to hear people speak quite passionately and eloquently about what it's like to help these families. We heard about people who've been working in food kitchens for many, many years, worried about who will be the volunteers to come after them, about the effect it's had on their mental health and trying to respond when the demand's increasing. Some of the data, we are depending on Statistics Canada information, tax filer data that is a couple of years old. But, that said, we spent several months speaking to people across this province, in this moment to hear that things are very difficult. So, yeah, it was powerful and it was difficult.
There's the stat that Jen mentioned, 25% of children under 6 in NL living in poverty, or an increase, the highest recorded in Canada. There's some mental health stuff that came up too, right?
Absolutely.
Yeah.
I mean, speaking with community organizations, they're seeing a lot of hopelessness and disengagement in youth. They're also bringing that anxiety of food insecurity, not having a stable place at home, poverty's following them into school to a point where they're seeing children kind of keeping some of the food that they get through school food programs to take back home to share with their family. So they're talking about how are children going to be able to engage in academics and building on themselves when they have this anxiety that they're carrying with them everywhere.
Yeah, because a lot of it boils down to social determinants of health stuff, and then when you look at the building blocks of community, and if at this level,
Absolutely.
this is these are the impacts of child poverty in Newfoundland and Labrador, and then you think of how do we, have healthy, thriving communities if at the base level there are children in poverty. So the report's getting at a lot of this stuff. And Nivi, here's a quote from you. Not to give you you're like, I know, Adam, I said it, but I just want all of us to kind of perhaps unpack this. Poverty is reshaping the environment in which the children and youth of Newfoundland and Labrador are growing up. Beyond lacking access to essentials like food and shelter, many children are experiencing a deeper sense of disconnection from their peers and communities, a reality echoed in the stories shared by organizations across the province. Newfoundland and Labrador's children face some of the poorest mental health and well-being outcomes in the country. Despite these challenges, community organizations continue to work hard to meet the needs of vulnerable populations. With enhanced investments in strategic areas such as guaranteed basic income, community housing, and wraparound services, our province can meaningfully address child and family poverty. So, this is the theme that's going to be through this whole show for what we are talking about from this press release that came out. But for you, as someone who's putting the report together, what goes across your mind as you're getting these inputs and you're putting out statements like this?
Yeah.
What are your thoughts?
Yeah, I think it's that we're seeing that all of these safeguards that children previously had are failing, and that's why we made that change to call it the Child and Family Report Card is that these supports, we heard from communities that, in cases where there were seniors taking care of children, they're not able to kind of step in and do that anymore because of the financial stress. And community organizations also, just based on funding and demand, are not able to keep up with that need. So it really is a family and community issue, and that's why it's so much more whole and encompassing than just child poverty. It's affecting children, which is awful in itself.
Yeah, but yeah, it's the bigger connecting net of a web of all of it, I should
Absolutely.
say. Right, Kim, what were your thoughts just on that? Like, just as you kind of take all of it in, from you either personally or with the Jimmy, with your position with Jimmy Pratt.
I feel like this particular report, while I think it's, in the spirit of all the reports, this is the third iteration of the Child and Family Poverty Report Card for the province, that we have to approach this, I think we have to start talking about this from a human rights perspective. It's been 35 years since the All Parties House of Commons resolution to end child poverty by the year 2000, right? And that was in ratifying the UN Convention on the Rights of the Child. So, I think we have to start, we can talk statistics, we can talk numbers. We seem to keep doing that. But I recently listened to the show last year on the Child Poverty Report Card. Things are getting worse. And you talked about that then. This should be a call to action, really. We've seen the highest increase in child poverty. Child poverty is up in every province and territory in the country. And as we mentioned, we're above the national average. We've seen huge regional disparities as well. That was another thing that we found as we moved across the province, were the regional disparities in child and family poverty. Rural and remote areas are struggling. Indigenous and racialized families children make up 5% of the population, yet over 30% of racialized and Indigenous families are living with poverty.
So then are you hearing more, like you're saying it should be a human rights thing, and each year report cards come out, and like you said, poverty is increasing. Are you hearing or seeing enough, from either the new provincial government, the outgoing one, federally, what more do you want to hear?
Well, I think we found out during COVID, for example, when there was an increase in the Canadian Child Tax Benefit, and when we saw the CERB transfers, we saw a reduction in poverty. And that was, that just proves that income transfers work, targeted income transfers work. When those things were reduced, we saw an increase very quickly. So that just speaks to the need for increases in targeted income transfers. We have a new provincial government now, but there's a lot that's been happening in the province over the last few years that needs to continue. So that's something that has to be talked about. In 2023 or 24, the poverty reduction plan for the province, that 3-year plan, there was $41 million that was committed to the poverty reduction plan. That needs to continue, right? And that was on top of the $18 million that was committed when the plan was rolled out. There are other things that are happening around the child tax benefit, the infant nutrition supplement that was increased or added, 300% increase in the child tax credit here. These things need to continue regardless of whether or not there's a change in government. The federal government has responsibilities, and then the provincial government, of course, is responsible for rolling that out across the province. And they need to start listening to people in the regions.
So do you think they get it then for the new government? Do you think they understand? Because if you're talking human rights and poverty increasing, do you think yes, there's been spending from the previous one. There's a poverty reduction strategy under the new one, but do you think they fully understand exactly where things are and the dire need that you've described, that this report describes?
I think there was a lot of discussion around needs during the election. We'll have to wait and see. If in fact that that rolls out in terms of action over the next while. It's very early.
But yeah, because the thing, and this is one thing that I noticed this week. Here's a headline. NL government promises donation to local food banks with sale of U.S. alcohol, right? So you had all this American alcohol, and then everyone's like, we're not buying this anymore. We're not getting any more in. It was there at the NLC. And now there's a pledge. NLC hopes profit can reach $1 million. They'll be donated to food banks. So, I mean, that sounds like that. Look, more money to food banks, it can help more people. But when you have headlines like that, does that show you an understanding of the – because it's all tax dollars. And the government is in control of where tax dollars go. So do you think there's an understanding there, or there's more room for them to understand more? And that's coming out of left field here, so you feel free to take a pass on it, but I'm just kind of putting it out there.
I think that any action that improves the situation for families in the province is positive.
Yep.
But let's face it, families in Newfoundland and Labrador need higher incomes right now to deal with cost of living, with inflation. Prices are skyrocketing. Rents, housing insecurity is up. Over 20% of families in Newfoundland and Labrador are living with housing insecurity. These are short-term actions. However, they're not going to. To me, that doesn't say we understand that families in this province are suffering and living with situations that are affecting their overall well-being, those social determinants of health. I don't think something like this is going to have a long-term impact on those issues.
Jen Crowe, what do you think?
I think what we're really, and just to build off of Kim's point there, I think what we really need to see is systems change and systems transformation in order to really move the dial on child and family poverty. I think the great thing is that we have good examples of what this could look like, right? And you can look at the data in the Child and Family Report Card. I'd certainly encourage your listeners to go on any of our websites and check it out. But you did see a measurable decrease in child and family poverty, my apologies, during the COVID years, and that was because of CERB. Yeah. So if we look at, okay, how do we make a measurable decrease in poverty rates? I think we really do need to look at whether it is something similar to CERB, increases in income support or basic income programs, some combination thereof. That's really what we need right now. And, there's always going to be a need for these emergency interventions. I personally was really pleased to see the investment in the Community Food Sharing Association. There's a massive need right now, no doubt about it. We see it every day at Choices for Youth. And also, what are the systems transformation interventions that we are making over the next 4 years and beyond to make a measurable reduction in child and family poverty? That's what I'm really eager to see with this new government.
Yeah, because, in the Williams years, under the PC government then, with the poverty reduction strategy, you had social assistance pegged to inflation back then, which was stopped and still has not resumed. And you're right, wait to see, right? So you have you're looking at need in the food banks, right? Community Food Sharing Association, talking about the emergency need that is out there. But then it's like, well, what's the question of the bigger strategy, the bigger plan? What is being brought out? So when it comes to youth, helping young people, children, youth across the province, I'm curious as an intro, because we've got someone who's going to come on to talk about this, but tell me about Becket.
Absolutely. Yeah. So, Adam, about a decade ago, we started this work. We were seeing this trend in St. John's where at the time, about 20% of the young people who were coming through our doors, and we support about 1,000 youth a year, so about 20% of them had recently arrived in the city. And we started with some federal investment. We started to dig into what is going on there. Like, why are all these youth coming into the city to access the types of supports that we offer, which, for your listeners, that is supports around finding housing, finding shelter, accessing mental health services, accessing food security. It's really for youth who are highly vulnerable and who have needs that are unmet. So we did a provincial consultation process about 10 years ago, actually, and we interviewed 1,000 young people. We did consultations and surveys with 1,000 young people and 300 plus service providers in 32 communities across Newfoundland and Labrador. And
That's big.
It was a lot, yeah. And we really found out two things. Number one, we kind of already knew this, but most of the youth who were coming into St. John's, they'll tell you, like, I don't want to be here. I don't want to be here. You hear stories all the time of young people for whatever reason, finding themselves in St. John's with, it's often all their belongings on their back. And I often say, like, if we're able to help them, we're really lucky. A lot of the youth who find themselves in the city don't find us. And it is in those situations that they often do end up street entrenched. They may be, unfortunately, having to make difficult decisions and choices that are not necessarily good for them.
Yeah, you're at high risk for exploitation.
100%.
There's the substance use and where that can lead you, exploitation, all of that coupled together.
Sleeping rough,
mental health impacts, all of
couch surfing, all of these things. So what we really wanted to do was, with that information and certainly a more nuanced understanding across the provinces, that in some cases these services don't exist. In other cases, they may just not be integrated. So a young person may just not know that they exist. So we started this process working with 8 steering committees across the province to try to define what could a model of integrated service delivery look like in regions across the province. And that looks differently, whether that's in Marystown or Gander or Goose Bay or Lab West, et cetera. And together we co-developed this model called Integrated Youth Services, which we have since kind of married to this national model that's happening across Canada, where there's 150 hub sites in development or operational across the country. And this is what is now Becket. So we were able to get investment through the provincial government, along with philanthropy and some investment through Health Canada as well federally, to really be able to formalize this and then actually launch this model across the province. And of course, that starts with Corner Brook. And just to say the name Becket itself.
Yeah, I was just like, where's Becket?
We were calling it like NL Integrated Youth Services, doesn't exactly roll off the tongue.
No.
But Becket was a name that we co-developed with young people. We have a youth advisory council that spans the whole province. And when we were trying to come up with a name, they said, what if we really grounded this in our Indigenous roots across this province? And what does it mean to make sure that when we are developing a model of care, that we're centering that in Indigenous ways of knowing, we're centering that in land-based activities, and we're making sure that it is inclusive for everyone across this province. And Becket is the Beothuk word for where you go. And so that's really where that word came to be. And so that's what we're calling this new model. But it's incredibly exciting. Our vision is 9 integrated youth services hubs across Newfoundland and Labrador. We have one in St. John's that's been operational for a couple of decades now, and soon a second one in Corner Brook, and hopefully 7 more to come. That's our goal.
All right, so we've got Krista Butler on the line. Krista's director of Becket, so Integrated Youth Services in Newfoundland and Labrador. 4 choices for youth. Krista, how you doing?
I'm great. How are you?
Good. Give folks. So we get, like, Jen gave us the broad, a description there of how everything works. Give me like a day-to-day of one of these hubs. Like, let me understand if I'm a youth who needs support. And you can pick whichever one you want, but just give folks an idea of how they function through the run of a day to a week and beyond.
Yeah, so each hub is going to be really geared towards local needs and local services, really driven by what we're hearing from young people, community, and service providers. So each hub, whether it's in St. John's or Corner Brook, day to day, they're going to look different, but they're going to be rooted in the same IYS principles, integrated youth service principles. So really a youth-friendly network designed to make it easier for young people to get the supports that they need in one place. So really it brings together the suite of services: mental health, primary care, substance use support, housing, employment, your social services supports, all under one roof. So young people don't have to navigate these systems on their own, so they can kind of walk in one door and access all these services. So the vision of Becket in Newfoundland and Labrador is that every young person in Newfoundland should be able to walk into a safe, welcoming space. Yeah. Or perhaps that might even be to connect virtually. We know some of our communities are rural, so virtual is definitely going to be a way that some young people are going to connect to these hubs, but really to get the right help at the right time.
So what types of help is it?
So whether it's mental health, primary care, so we have a partnership with Newfoundland and Labrador Health Services. So they've been a core partner. Choices for Youth is the admin host. Newfoundland Health Services have been a core partner, so they are going to offer primary care through the family care teams in Corner Brook and our other hubs. In St. John's, we have a partnership with the Downtown Health Collaborative that they provide primary care supports to Carter's Hill. Providing mental health supports as well. So we're going to work with Newfoundland and Labrador Health Services to make sure those services are provided. And then we'll work with community and the lead agencies, so each hub is guided by a local established lead agency. And in Corner Brook, as Jen said, that's Vine Place. So Vine Place will lead the day-to-day operations in Corner Brook. So we'll make sure that, there's a hot meal each day, people have a safe space to go, and really come in and connect with someone to help with system navigation.
Okay. So, yeah, if I'm a young person, we've mentioned this on the show before, but this is a cross-Canada example. If I end up dropped into town somehow, in a lot of places it's by bus, and somehow I make it to one of these hubs, right? So let's say the St. John's one, and fine, I need there's some kind of healthcare situation I need. So it could be a nurse, it could be a doctor, it could be a mental health professional, it could be a social worker. You have all that there, hot meals, and also assuming peer-to-peer support with folks who understand the situation you're in. Jen, go ahead.
Yeah, that's right. So just to kind of paint a picture, the model in St. John's, and it will be quite similar in Corner Brook or anywhere across this province, as Krista mentioned, it's the shared model of fidelity across those 5 core areas of mental health, primary care, housing, employment, and education and community. So a young person comes through our doors at our current Becket hub in St. John's. They often will come at them for a hot meal. That's kind of what brings them in the door, but it's what brings me indoors sometimes. Is they come in for a hot meal. While they're eating their hot meal, might have a conversation with a support worker. Look, an example. I've been finding it so hard to get out of bed in the mornings. I'm really feeling low. Okay, a bit of a conversation around what's going on. We got a therapist on site. Would you be open to a 30-minute conversation with them? Let me bring you across the hall to them. Let me bring you down the stairs to them. And through a conversation with a therapist, what might come out of that is, the reason that you're finding it hard to get out of bed in the morning, you're really experiencing maybe symptoms of depression, is because you don't know if you're going to be able to make rent this month, and you just lost your job, and those things would bring anyone down. So can I bring in a support worker, again, across the hall, to have a conversation about getting you connected to employment, maybe through one of our social enterprises? Can I have can we bring in a housing support worker to help get you connected to stable housing? Maybe it's one of our units. So these are the conversations that happen. It's about the symptom and it's about the cause. And the idea is that instead of sending a young person across town to a drop-in clinic, it's sending them across the hall. And the reality is that if we can send them across the hall instead of across town, the likelihood that they're going to make it there is much higher, and the likelihood that they're going to get better is much higher.
Yeah, you're
so
removing
that's the model.
You're removing barriers, right?
Absolutely.
All the barriers for a young person who may not know where to go, who to get in touch with, how to get there. There's transportation barriers, you name it. Those get removed, and it helps. Krista, for you, what's it like overseeing this work and seeing folks, young people in this province, get the help they need and hopefully graduate and move with progress step by step into a better direction?
So it's been absolutely, a wonderful journey for sure. Watching, working alongside, working in connection with our communities has been so empowering to me. Communities are really doing great work, just needing the extra support to create a strong network so that we know, we're reducing wait times for young people, reducing frustration that the young people and families feel, and increasing connection in community. It's been super amazing. And seeing, we've been so fortunate to be connected with our Pan-Canadian partners. As Jen said, each province and territory has IYS either in development or providing services to young people. So working with our partners across Canada, learning from each other, and really not feeling alone in this has been amazing.
Krista Butler, thank you so much.
Thank you, Adam.
I want to go back to Kim Dreaddy for this part of the conversation. So Jimmy Pratt Foundation Executive Director. So, we're talking about this 2024 Child and Family Poverty Report Card. And also for Jimmy Pratt, it's about, as you mentioned, and I'm just looking at your website here now. Can you see my screen? It's supporting systems changes so that children and youth in Newfoundland and Labrador flourish. At this point, I know another report will be compiled for next year, but you've got one that's out the door. You mentioned it's number 3, the learnings for it. How does that help inform you in your position and what Jimmy Pratt is doing?
It's it's critical in a lot of ways because there are significant. There's a lot of intersectionality when it comes to housing, housing, food security, mental health, child care, all of these sorts of things which impact young children.
Yeah.
It's interesting because you can't talk about poverty and not talk about all of those things. So for us, I guess that sort of mirrors the things that we have to focus on, right? So if we're interested in children having the best possible outcomes, the best possible chance at life, we can't just focus on one area. There's a lot of discrimination as well, systemic discrimination that happens. So for us, I mentioned earlier, right now, it's not just child poverty that we're looking at. We're looking at early learning and childcare situations. The province has just announced that they've run out of money this fiscal year for the $10 a day program. So the Canada-wide early learning and childcare Newfoundland bilateral agreement, spans 10 years now because we just added another 5 years. You know, if the province has run out of money in this year for $10 a day childcare, even though that's one of the pillars of this Canada-wide early learning and childcare agreement, then there's something wrong there, right? So we need to focus on that. So we shift slightly. So early learning and childcare. We can't talk about, one of the things we mentioned in the report is that I think it was in 2023, a report showed that 79% of communities in Newfoundland and Labrador were child care deserts. That just means essentially that there's just not enough child care spaces for every child that's born and in a certain age group. The province is increasing child care spaces, but obviously they're not meeting those targets. One of the things they mentioned was that there was an increase in demand, but that shouldn't speak to them not reaching the original targets, for example. So we're So in your question being, how does this sort of impact our work? We move in the direction where the need is. So childcare. We start to look at childcare and spaces, and then we realize that there's a crisis in the early learning and childcare educator sector, right? So then we have to spend time on that, advocating, doing research, presenting evidence. We are focused on informing policy, but in order to inform policy, we have to be able to communicate with government.
Yeah, and it's not like there's how we feel, but this is not about truthiness. This is about, look, we've got information and stats. This is from Stats Canada. This is helping to inform where we're coming at for the policy discussions we're pushing towards. We had retired Chief Liz Lasaga from Flat Bay on the show a few days back. We were talking about gender-based violence under the 16 days of action. And Chief Lasaga mentioned something you mentioned too. It's all connected, right? So if you're talking about gender-based violence, that discussion talked about food insecurity at high rates. It talked about food security and shoring up the need. So, and then here we are in another discussion. What's childcare? Having childcare deserts, and thinking if you're in a part of the province where if you're in a childcare desert, what does that mean for the parents there, the families there, and then to talk about poverty levels and everything else that we're talking about here, and how it's all connected into. You can't just have a conversation in a silo because it doesn't work that way if you're going to actually talk about meaningful change, in a province. Nivi, any thoughts you want to jump in on there?
Yeah, I think it just comes back to what I'm hearing from the community members when they're talking about the changes that have happened. And the thing that really stuck out to me was a comment on the 2023 poverty reduction strategy, the income support changes that had been made. And they were happy about it, but they weren't really seeing it translate to their ability to comfortably make purchases around food in other areas. And there was a study done recently by Just Food, and they're projecting a 6% inflation rate for 2026. And that's and the base inflation rate is at 2%. So that means that more and more families are going to feel that pinch when they go to the grocery store and see things on the shelves. So that threshold that we have for child poverty could be getting higher. And when our income support level hasn't really targeted, like you mentioned, to inflation rates, where does that really put families? So it's a bit of a scary thought for me.
Yeah, well, and just to think of, you're right, like when you think of as inflation keeps ticking, especially in the food file side of things, and then if the money's not going up to match that, what are the folks doing without? And then you have conversations around, so then it's conversations on the food insecurity side of it, of parents skipping meals, of just trying to figure out even how to pay heat and light bills type of a thing. So then you get the skipping meals, and then it trickles down to the kids and everything else for nutrition. Yes. And then we have these conversations. We did end of October, we had a food bank show, and we talked about the higher demand and working families going in. There was a description from that show of a parent eating a meal from, because the Single Parents Association gets meals from the hospitals that are left, and the description of that show was of a parent sitting in their car eating a meal with their hand. And so if you want a description of some of the impacts of the reality of what some folks are facing in this province, that impact and that kind of example has stuck with me, because it just, what does that say to that family? And then what does that mean for communities and support, and everything else? Tell us some more, Jen, about where things are going and pushing the direction on because the solution side of it, right? We're talking about evidence-based solutions of looking for advocating. Tell us more.
Absolutely. So one of the things, and I think this conversation and certainly the report card's really reminding me, as an organization at Choices for Youth, we've really, I would say, shifted over the last several years to take more of a prevention-based approach and more of a family and natural supports-based approach. So what do I mean by that? When we look at the statistics in this report, we look at the rise in child poverty. We look at the fact that we are well above the national average when it comes to child poverty, and the highest in some of the categories on child poverty of any province. To me, child poverty is family poverty. We need to look at those two things together. And one of the things that we've really been focusing on at Choices for Youth is when we look at homelessness, the number one cause of youth homelessness is some kind of breakdown in that family. So what you see is a breakdown. Could be a fight, could be, a parent doesn't accept a young person for being part of the 2S LGBTQI plus community, kicks them out. There's all kinds of different reasons. Family breakdown, young person leaves or is kicked out, becomes homeless. If we think about that as the number one cause of homelessness, then one of the top solutions for ending youth homelessness is reconnection between young people and family, or what we call natural supports. That could be a coach, it could be a family friend, it could be someone else who's close to the family. So we can't separate these two pieces. And when we think about how we're going to end youth homelessness and how are we going to end poverty for young people and for children, we have to bring it back to how do we make sure families are very well supported. And I'll just give you an example of what this looks like in our work. If a young person comes through the door, there was, many years ago, the inherent kind of reaction would be, oh my goodness, okay, let me try to get you a shelter space somewhere in the city for tonight. Let me just try to connect you to it. And it could be our own shelter, it could be somewhere else in the city. The reaction over the last several years, which I'm really proud to see the shift, is tell me what's going on in your life. Tell me about who's in your life that you trust. And can we give them a phone call? Right. Could you stay there tonight? Could you stay with your aunt? Could you stay with that family friend? Is there someone in your network who's a safe person who can provide that community for you? Because whether it is talking about the work we do in St. John's or the work that we get to do now in partnership with Vine Place and Corner Brook, organizations like ours cannot replace the value of family and community, and we never should strive to do that. What we can do is connect youth back to their community. We can connect them with the resources that might provide a pathway back to community. And that's really what we're striving to do here. I think it's very well illustrated in this report card, the need for that. And it's very well supported through this Becket Integrated Youth Services model that this could provide that pathway back home, back to community, and back to a sense of connection. And really, that's what all of us need in order to thrive. We need to feel like we have community. We need to feel like we have people who are in our corner. And that needs to be not a paid staff member. It can be for a short period, but ultimately it needs to be a family member, a natural support, a friend, a coach, a trusted member of your network who can help you pave the way forward for yourself.
So then this is why, and correct me if I'm wrong on this, but I'm fairly certain I'm right. This is why it's so important to keep young folks close to their communities
100%.
for everything you're laying out there, as opposed to coming in, and I'll use St. John's again, right? As opposed to coming into St. John's where you don't know who, what, when, where, why, and how, and the chances of finding a support network, real tough compared to if you can stay closer to where you live.
That's it, Adam. And I think what we're really striving to do through the Becket model is I would love to be sitting across from you in 5 or 10 years' time and talking about how we've seen a 20% reduction in the number of youth coming through our doors from other parts of the province, because guess what? They're getting their needs met closer to home. And I'll say today, 31% of the youth who we support have just arrived in the city. Let's try to get that number down, and I think we can get that number down by supporting them closer to home.
We've got Mike Kearley on the line, Executive Director of Vine Place Community Centre in Corner Brook. Mike, how you doing?
Well, I'm doing great. How are you doing?
Good. Tell us a bit, expand on this conversation around challenges for providing services in rural areas, because we've been talking about how young folks can end up in St. John's. I mean, now, Corner Brook's not small, and I'm assuming young folks can end up there from other rural areas, but just talk a bit more of some of the challenges of providing services in rural parts of, in this case, the island.
Well, I think one of the biggest challenges has always been resources. And, again, this opportunity with Becket is an opportunity to coordinate and bring resources to, rural Newfoundland, Labrador. And, that's always kind of been a very difficult situation for not-for-profits, particularly outside of Metro St. John's, is to get the coordination and get the resources that we need. And this has just been an excellent opportunity. And I mean, again, to go back, this also affords us the ability to provide resources that are specific to the needs of youth in, say, Corner Brook, Bay of Islands, West Coast area.
So how are things? Tell us about how things are working for you now with the day-to-day and what this can mean for folks, for young people.
Well, it's an opportunity to get wraparound services in one place. As Jen has probably mentioned, the research says you have to meet youth where they're at. And this is an opportunity for them to get a lot of services under one roof, everything from social, recreational, employment, health, mental health services. So, this is a big game changer for particularly youth in the Corner Brook area. So
for yourself then, as Executive Director of Vine Place, and you're saying things like game changer for what it can mean for youth in the area, what's that like for you and the work that you're doing?
I think it's a great opportunity. I mean, it really provides a lot of great resources for the youth that we already serve. And, like day to day, it'll be a little bit of a challenge to run essentially two kind of organizations, but we're my staff and myself, and we're really up for that challenge, and I think it's going to be very fulfilling.
Yeah. So then give me a bit of that look ahead. So you mentioned the two things you're running as things are as things function. Next year, the year after, when things are really, and you said game changer, but paint a bit more of a picture of like once things are working, how it will work.
Well, we're currently, and I guess that's one of the things is that we are still getting the input from youth about what they want to see. But as a general, what we're looking at is to have like an outreach service where they can, as something as simple as just come, sit down, and hang out and talk to someone. Yeah. To hopefully, like I said, mental health services, a counselor will be on site. We're also working with NL Health Services, a great partnership with them, and looking at the family care team to also be available. So, I mean, really, we're still in that planning process, But the main idea is, the services that we have may be different than what you would see in St. John's or any other youth hub. So, this is great that the services that we plan to offer are going to be, I guess, tailored to the youth in this area.
Okay. Mike Kearley, thanks so much for coming on the show, and good luck with everything.
No problem. Thank you very much for having me.
Kim Dreaddy, I'll go back to you on this. We've talked about regional disparities, right? So now I know this is a Choices for Youth wraparound services example, but when we looking at this report that was compiled, and then when you think of regional disparities as holes start to get plugged, just wondering your thoughts on that, and if it's a lesson for other parts, whether it's childcare that you've already mentioned, or for other bits for filling in some of the family poverty issues for this province.
The disparities we saw were fairly broad. There's parts of this province that, while you see an 18%, the 18% average for child poverty across the country, there are parts of this province that have over 30, 33, and 34%.
Yeah.
Improving services in communities to, wraparound services are critical, but they have to be ones that impact people's ability to be employed and to be able to access those services. We can talk about income transfers, which are critical. We know that income is one of the very important social determinants of health. But we also have issues like transportation and, as I mentioned, childcare. Transportation in parts of this province is it doesn't even, there's no public transportation in many areas. A lack of transportation, affordable transportation, can be one of the major barriers for people to access basic health services, education, employment. I think the programs that are being developed, and certainly Becket is an excellent example, would need to depend on those resources and some of that infrastructure being there as well for it to really thrive and be able to be sustained over time. So it's a very complex issue, but it's not something. I think last year when you had this conversation about the 2023 Child Poverty Report Card, it was mentioned that I'm going to repeat it. It's not inevitable. Child poverty is not inevitable. It's really a choice that governments are making.
That kind of gets to my question earlier about where some of the money and the choices around, okay, what do we give, what gets given from governments, no matter what level, from tax dollars into programming. And this is down to that point. You're saying, so the point is that you just made, levels of poverty are a governmental choice. Anyone with thoughts on that?
I think there's a real opportunity and certainly kudos to the current government for already saying that they are going to invest in the implementation of a poverty reduction strategy. They've also made they have committed to, I believe it's 10,000 new units of affordable housing or housing in general. So these are all good things, right?
Yeah,
I think these are positive pieces. I think, you had referenced tying income support to rising inflation. I think that would be a very good low-hanging fruit intervention to look at, along with something that's perhaps a little bit more of a sizable contribution on the income side, i.e. a basic income. There's been community organizations, including ours, advocating for a basic income for several years. But I do want to just pick up on Kim's point regarding a pathway to gain an income. This is so important, and it's something as an organization, Choices for Youth, we've invested in for many, many years, is that we're not going to see a reduction in youth homelessness and or youth poverty unless we really considerably invest in young people's pathways towards employment. And it's so interesting, as we did the consultation around Becket and what this model could look like, I think every single one of our steering committees said, we would love to see social enterprise training and employment embedded within this model. Because if we think about a quote unquote one-stop shop, the opportunity for a young person, and this is kind of the model that we've been able to develop at Choices for Youth, the opportunity for a young person to get referred within our organization to both a safe place to stay, stable, supportive, transitional, or affordable housing, but also a job, right?
Yeah.
Like we own and operate 3 social enterprises, and they provide really valuable skill development, training, and employment opportunities for youth so that they can transition to the labor market. And to me, that is a huge opportunity as we think about building out this model across the province, is how do we make sure that once a young person gets, maybe it's a bit of mental health supports, a bit of primary care, they get stabilized with their housing, that then there's a conversation around, okay, how do we get you connected back to school, to post-secondary education, or to employment? And social enterprises is such an interesting mechanism to help make that happen and help generate revenue that can be reinvested back into organizations like ours. It's like this, it's a double bottom line, right? It's revenue generation, but it's also social impact, and provides incredible opportunities to young people. So that's, I think, in terms of a tangible solution, I'd love to see continued or increased investment in the development of social enterprise.
Well, then, if I'm thinking about social enterprise, for some reason I have pizza on the brain because I want you to tell me about Crust, if you could. Please.
Absolutely, yeah. So Crust Craft Bakery is a social enterprise we've been running on Pearson Street for many, many years. We have many followers in the East End who are very, very disappointed that we recently made what we think is a very exciting move to our new permanent social enterprise and innovation hub on 340 Le Marchand Road. So for folks who are interested, you can come by. We are open Wednesday through Saturday, 11 to 8. And you can grab a fresh slice of pizza, which is made by young people in our community who are facing barriers to employment, who are not only getting a great job, but also getting trained on how to work in a kitchen, how to work in front of house. And many of them transition on to working in many of the kitchens in our city and or to culinary school. So it's a great, especially around the holidays, a great opportunity to support an excellent social cause while grabbing a delicious slice. And I think the best scones in town, but I'm biased. So tell me yourself if you agree with me.
Well, and yeah, so it's moved to an exciting part of the city. And then we had the crowd from Stella's in the other day, and they were talking about the reopening of the Hungry Heart Cafe. Yeah. So, things are balancing out in terms of social enterprises.
There you go. Love it.
Within the city. And have any thoughts from yourself just on the couple of things brought up towards the tail end of the conversation today?
No, I think it's just exciting, like offering more opportunities for youth to re-enter the employment pathway. I think that would significantly help. And as we expand into areas across the province, I mean, we're hearing from people in central Newfoundland where they don't have that option. And when you have transportation barriers, like a $30 taxi to your place of employment, can we find a way to get youth stable job opportunities that will help them build themselves, that also don't kind of take away from their basic needs? So yeah, those are my final thoughts.
Yeah, I think during the pandemic, it was when we were doing some coverage, and the barrier of transportation and food was something that actually crystallized more, because I hadn't spent a whole lot of time thinking about it, and it wasn't until we were having these conversations, and then that was in the city, but then you start conversations I've had with folks in Carbonear, the food bank there, and across the province, and then you start to think. And then when you talk about jobs and when you talk transportation, of course, right? You realize the barriers that it can be. All right. Well, thank you. Final look aheads from either of you.
I think on my side, I'll just quickly mention, we've thrown a lot of stats at you today.
Yeah, a lot of information. But,
but one of the things that we've been able to measure over the last several years, we do quarterly impact surveys, which I could bore you to tears on for a lot longer than the 30 seconds that I have. But ultimately, we've been able to measure that through the wraparound supports model that we provide through Becket in our St. John site. We see, for those youth who come to us and are struggling with their mental health, we see 62% of them who actually see a measurable improvement in their mental health within just 12 months of engagement with us. And, to me, we have to focus and invest in what is working. And the Becket Integrated Youth Services model, again, we took from a model that exists pan-Canadian right now. It is really working on moving the dial on youth mental health, but it's also, we see that 62% improvement in mental health, but we also see for young people who come to us who are homeless, 81% of them attain and maintain stable housing within 12 months of engagement with us. So those two things we've talked a lot about, like it's all inseparable. But I think if we can really invest in housing stability, we're investing in improvements in mental health. If we can invest in improvements in mental health, there's a pathway towards housing stability. These two things go hand in hand. You add in opportunities to gain an income, and that's where those three things, young people are able to stabilize and build a better future. And that's what I'm so excited about through the Becket Integrated Youth Services model. But I'm also so pleased to see for the first time child and family poverty report card, because ending child poverty means ending family poverty, and I know that we can do both in this province.
Jen Crowe, thank you so much for that. So Kim Dreaddy, final like a look ahead into next year, Jimmy Pratt Foundation, some of the stuff you're going to be working on, or final thoughts.
We're working to expand our profile and our position and our knowledge around inclusive education, truly inclusive education. And so that's something that, you'll see us develop over the next while. We will stay committed to working on the child poverty report card for the next year. And you'll certainly see and hear us talk about childcare, accessible, affordable, universal childcare as a pathway to, economic security and independence for families. As far as this goes, yeah, thank you.
Thank you so much.
There's the music.
Yeah, it kicks. Oh gosh, yeah, it does kick it, doesn't it? I'm looking at the clock there. That is it for today's show, folks. I'm Adam Walsh. Send us a note, the signal at cbc.ca. Tomorrow we are talking about defense spending, artificial intelligence, what it can mean for Newfoundland and Labrador. Folks from the tech sector will be in, and also an interview with retired Vice Chief of the Defense Staff. Cheers.